Hello, my name is Jocelyn. I'm going to be your student nurse today. Do you mind if I come in?
Yes.
Okay, do you mind confirming your name and date of birth with me?
Millie Larson, February 16, 2000.
Okay, and then I can confirm that on your chart. Do you mind if I confirm that on your wristband? Perfect. Do you have any allergies? No? Okay, so I'm just going to grab some gloves. Do you know what brought you in today?
I fell in my garden and hurt my ankle.
Okay. Do you know who the President of the United States is?
Biden.
Okay, do you know what day of the week it is?
It's Wednesday.
And then do you know where you are?
Yes, I'm at Concordia Hospital.
Okay, so you're alert and oriented times 4. I noticed no abnormalities in your speech, no involuntary movements. And then back to the pain, do you mind pointing where it is? Okay, does it radiate or is it more localized?
It's localized and it's sharp right now.
Okay, so sharp, that's what it feels like. And then what would you rate it on a scale of 0 to 10, 10 being the worst?
Right now it's like an 8. Whenever I take my foot off of it, it's around a 5.
Okay, so anything that makes it better or worse?
Ice makes it better. When I'm walking on it, it's very painful, so it's probably its worst.
Okay, and then how long has this been going on for?
I fell yesterday, so.
Okay, and then just to confirm your vitals, just to check if that's appropriate for you, we have temperature as 98.8 Fahrenheit, blood pressure 146 over 84, and then oxygen saturation 97% on room air. Is that appropriate? Okay, so I'm just gonna go ahead and do your head to toe assessment. So I'm just gonna start from the head, work my way down to your toes. If at any point you feel uncomfortable or want to stop, please let me know. So I'm just gonna start off with your head. So just looking at the scalp, I noticed no skin breakdown, no lesions, and then no signs of alopecia. Hair distribution is even. Looking behind your neck, no signs of pressure ulcers, no skin breakdown, and skin color is appropriate for ethnicity. So just looking at the ear, the external surface, no skin breakdown, no lesions. I'm gonna go ahead and look inside. No excessive cerumen, skin breakdown, there's no skin breakdown, skin is intact. So I'm gonna check the same thing on the other side. So looking at the external surface, no skin breakdown, no skin lesions, and then looking inside, same thing. No excessive cerumen, no skin breakdown. Just gonna go ahead and check your temporal pulses while I'm here. Pulses are strong, equal bilaterally 2+. Skin is not too warm or too cold. It correlates with what we have on the vital signs. Now I'm just gonna check your eyes. So you can just look at the wall. Pupil size is 4 millimeters. So do you wear any glasses? No. No contacts? Okay, so I'm just gonna assess your 6 cardinal fields of gaze. Just please look at the pen, don't move your head, just follow it with your eyes. Okay, and then just look ahead. I'm just gonna check for dilation. I'm gonna shine a bright light into your eye. Okay, so pupils are equal, round, and reactive to light and accommodation. I'm just gonna pull down on your eyelids. Sorry about that. Sclera is white, conjunctiva is pink and moist, and then no signs of jaundice, no abnormal movements in your eyes. Looking at the nose, I noticed no signs of skin breakdown. Can you please look up? Just gonna look inside. No septum deviation, no excessive mucus, no polyps. Looking at the outside of your mouth, I noticed no skin breakdown, no abnormal colors. Skin color is appropriate to ethnicity. Do you mind opening your mouth and sticking out your tongue? Tongue is symmetrical. Oral mucosa is pink and moist. Do you have any excessive cough, any excessive sputum? No. Do you wear any dentures?
No.
No. And then do you have any loose teeth?
No.
No? Okay, so teeth are intact. Tongue is symmetrical as well. Like I said, oral mucosa is pink and moist. Do you have any difficulty swallowing? No? Okay, swallow please. Okay, so no tracheal deviation. I'm just going to check your carotid pulse. So I'm going to check one at a time. Pulses are strong, equal bilaterally 2+. Now I'm just going to check for skin tint, and I'm just going to pinch the skin on top of your collarbone. There's no skin tenting, that means there's no signs of dehydration. I'm just going to run down my hands. Do you feel that? Mm-hmm. Sensation is present in both arms equally, and then let me see what else. I'm going to listen to your lung sounds. So my stethoscope might be cold, so I apologize. Every time I move my stethoscope, just please take a deep breath in and out. I'm gonna listen to 6 points on the anterior and then 8 points on the exterior. Lungs are clear to auscultate bilaterally and the anterior and posterior side. While I'm here, I'm just going to check for any signs of coccyx breakdown. So there's no skin breakdown in the coccyx. Going back to the front, I'm just going to check your brachial pulses. Pulses are strong, equal bilaterally 2+. I'm going to check your radial pulses. Pulses are strong, equal bilaterally 2+. And then just gonna come back here, have you take a deep breath in. Okay, same here. So breathing is unlabored, chest falls and rises equally bilaterally, and then chest shape is symmetrical. So now I'm going to listen to your heart sounds. So I'm gonna start off in the aortic. Pulmonic. Curves, equal to tricuspid, mitral. Okay, and then lastly, I'm just going to listen to your apical pulse. It's on the left side between the 4th and the 5th intercostal space on the midclavicular line. I'm going to stay there for a minute. Nothing's wrong. I just have to listen for a minute. Okay, so your heart rate at your apical pulse point is 76 beats per minute. The rhythm is regular. So that's the rate. While I was there, I stayed for 30 seconds to count your respirations. I got 17 breaths per minute. That's also the rhythm, and the rate was also regular. Okay, so next I'm just gonna go ahead and check for any skin breakdown in the elbow. So please go like this. Okay, so I see no skin breakdown. Skin color is appropriate for the ethnicity. And while I'm here, I'm just gonna check for range of motion. So just hands up, down, and up. So you have full range of motion in the upper extremity. So now I'm gonna check for the strength in the upper extremity. So I'm just gonna put my hand here, shrug. Okay, and then squeeze my fingers, push, and then pull. So strength is 5 out of 5 symmetrically in the upper extremities. Just gonna ask you a couple questions before I move on to your abdomen. How often do you urinate?
5 to 6 times a day.
Okay, and is that typical?
Yeah.
Okay, and then when you go, do you notice any pain and difficulty?
No.
No, and then can you make it to the bathroom in time?
Yes.
Okay, when you go, do you notice any foul odors or any abnormal colors? No? Okay, and then when you have bowel movements, how often do you go?
Once a day?
Okay, and is that typical for you?
Yes.
Okay, when was the last time you went?
Yesterday?
Okay, and then can you describe what it looked like?
Brown and solid.
Okay, and then do you have any pain, any blood?
No.
No? Okay, and then on a regular basis, what do you eat? What does your diet look like?
I have 3 meals a day. I'll have like cereal for breakfast, a sandwich for lunch, and then pasta for dinner.
Okay, so we, if you want to maintain a balanced diet, any recommendations, we recommend myplate.org, free website online. It's great for to get the proper nutrition. Any recommendations? And then how many cups of water do you drink a day?
7.
Okay, so we recommend 8 just for proper hydration. So try to get that up. Okay, so now I'm gonna move on to your abdomen. Do you need to use the restroom right now? No. Okay, so I'm gonna help you lay down. So you're more comfortable. Okay, so just looking at it, I see no abnormalities, no distensions, no lumps or masses, no enlarged organs, and then skin color looks appropriate. So I'm just gonna go ahead and auscultate first. I'm going to start off in the right lower quadrant, right upper quadrant, left upper quadrant, then left lower quadrant. So bowel sounds are normal active in all 4 quadrants. Now I'm going to go ahead and palpate your abdomen. I'm going to start off with light palpation, so go about 1 to 2 centimeters deep. If you feel any pain or discomfort, please let me know. Okay, so skin is soft, non-tender. I didn't feel any abnormal masses, lumps, or distension. And now I'm going to go in with deep palpation, so about 4 to 5 centimeters deep. Just palpate your bladder last. Okay, so there is no bladder distension. It's not rigid. Same thing. Skin is non-tender. The abdomen is non-tender. There's no abnormal lumps, masses, no distension, and then no enlarged organs. So I'm just gonna help you. So now I'm just gonna test for strength. So I'm just gonna push down and you push up. Okay, I'm gonna check your popliteal pulse while I'm right here. So the pulse is weak, but I'm going to check for other ones down, so that's okay. And then I'm just going to check for pitting edema. That's a 0 on the edema scale. I see no swelling. And then I'm just going to run my hands down. Do you feel that? Okay, so sensation is present on both on the lower extremities equally. And then I'm just going to check the posterior tibialis pulse. So the pulse is strong, equal bilaterally 2+. I'm just going to check for the dorsalis pedis pulse. The pulses are strong, equal bilaterally 2+. And then I'm just going to go ahead and check for strength. So just pull back and then push forward. So strength is 5 out of 5 symmetrically in the lower extremities. I'm going to check the capillary reflows in the toes. So capillary reflow is less than 3 seconds on the toes. So I'm just going to go ahead and change my gloves. I'm just going to check the capillary refill on your hands really fast. I forgot to do that. So capillary refill in the upper extremities is less than 3 seconds. And then I'm just going to help you get up. I'm just going to test your range of motion. And then can I have you walk to the door and back? Okay, so gait is steady with slight guarding in the right ankle. That's to be expected since you have an injury. Okay, so I'm gonna help you hold on to this and then just copy what I do. And then out, and then back, and up, out, back. So you have full range of motion in the lower extremities. I'm gonna help you back up. I'm just gonna check one more thing. Do you mind pushing up? Okay, and then push down. Okay, so you have 5 out of 5 strength symmetrically in the lower extremities, full range of motion in the lower extremities, and then steady gait, as I mentioned, slight guarding in the right foot. So that completes my head to toe assessment. Do you have any questions for me? No? Okay, so then I see here the doctor prescribed 400 milligrams of ibuprofen every 6 hours as needed. For pain, rest, elevate the ankle, and then apply ice for 20 minutes to the ankle 3 times a day, and then follow up with the doctor in 2 weeks.
Thank you so much.